Well, good afternoon, everyone. The page continues to turn on the COVID-19 story, but unfortunately, a happy ending is not yet in sight. We continue to wait for news that coronavirus is in retreat in other countries, and the number of infections and admissions to hospital is starting to fall. That day will come, but it is not yet here. France and Germany have announced new lockdowns. A study published this week by Imperial College London says the epidemic in England is accelerating, with the number of infections doubling every 9 days. That's almost 100,000 people catching coronavirus every day, with cases rising in every age group and region. The report warns that the measures in place have not prevented the R number from increasing. Tuesday saw the highest daily death toll since last May, with sadly 367 deaths recorded. Scientists warn that the second wave of COVID has not yet peaked and may be longer than the first. Also this week, researchers have suggested that immunity against coronavirus may only last a few months after infection, based on a sharp fall in the number of people testing positive for antibodies. What that means for the Isle of Man is continued vigilance. We must constantly scrutinise and adapt measures we believe are right for our island nation. In the summer, we eliminated the virus and maintained a COVID-free status for more than 100 days. We now have a small number of cases among people self-isolating. I can confirm that we have one new confirmed case. The individual reported symptoms while self-isolating after travelling to the Isle of Man, and close contacts have been identified. We have a test, track and trace system that allows us to monitor the situation closely. Our health service has plans and resources to manage a further outbreak should it happen. In the island, people are living without social distancing, face masks or other daily restrictions. Schools and workplaces are open, events are being staged. People can enjoy themselves. We are comfortably on top of things. But it is vital we continue to assess the impact on us of events in the United Kingdom and beyond. Back in the summer, I imagine most of us thought that by autumn the pandemic would be largely behind us. Instead, almost 11 million people in the United Kingdom are living under unprecedented restrictions. So, with the situation on course to become worse before it gets better, we are investigating all options on how we can recalibrate our outlook. Further announcements will be made in the outcome from this work in the near future. But first, I welcome back to the podium Health and Social Care Minister David Ashford, and the bed rest looks to have done you good, David. Over to you.
Thank you very much, Chief Minister. One issue I want to raise today is in relation to the procedure of people making an appointment with the GP, with the GP's surgery. The Chief Minister and I have stood here many times to praise the Manx public for their incredible commitment in helping our island through the pandemic. And it has been amazing how, as a community, we have come together. But I've got to say it has been a bit disappointing that I have heard reports in recent weeks of staff in GP's practices being spoken to rudely and even aggressively when the practice staff have asked the questions they need to ask before booking an appointment. GP practices and the department have agreed on a standard procedure when people call for an appointment, and it applies to all GP surgeries. Yes, as an island, we have kept coronavirus, COVID-19 at bay, but it hasn't gone away altogether. Our frontline health staff play a vital role protecting the most vulnerable patients and ensuring that our vital services continue to run. So when patients call the doctor, the receptionist does need to ask a number of questions to see if any precautions are needed before that person attends the surgery. These include asking whether the person has had any COVID-19 symptoms and whether they have travelled off-island recently. The patient's request for an appointment is dealt with after this step. The questionnaire is essentially a risk assessment, a basic screening which is being implemented on the basis of professional advice. It is best practice. Similar questions are asked of patients before they go into hospital, and the ambulance service also takes a similar approach. So I would just ask people to bear in mind and remember that the staff are asking these questions to keep us all safe as a community. If a risk is identified, It doesn't mean the patient can't have an appointment. It just means that the appointment has to be more carefully planned. I've heard that patients are saying there is no community COVID cases in the island, so why should I have to answer the questions? Reception staff have also, I believe, been told to mind their own business, or in some cases worse. Some of these encounters have left GP practice staff deeply upset and distressed. As patients, when we go to the GPs, we expect to be treated with courtesy, dignity and respect, and surgery staff should be able to expect the same. These unpleasant encounters are making life difficult for GP staff, and we need to reverse that. If patients refuse to cooperate, then ultimately it is going to delay them getting an appointment. The fact is we do need to maintain our guard against the virus and ensure that sensible precautions are in place, and that questionnaire is part of this. It's for everyone's sake. None of this is obviously ideal, but life is far from perfect at the moment, but we are better off than most. Our GP practices worked exceptionally hard during and since the pandemic to do their very best for patients and run their practices in line with the guidance, which was unfamiliar and for some scary. GPs are often our first point of call when we have a health problem. Many of us value our relationship with our doctor. It is one of trust and confidence. Nothing about the receptionist's questionnaire and questions changes that. So please, can I just appeal that we all uphold mutual tolerance and respect and continue to show that great community spirit that has really been at the forefront of this year. Thank you, Chief Minister.
Thank you very much, David. Now, the Council of Ministers has considered a series of options. Yesterday, we had a look in detail at a number of options for modifying our testing regime. Last week, I promised we would look again at how we can help patients who travel to the United Kingdom for medical treatment on a regular basis. Having to isolate for 14 days after each visit means that some patients are in almost perpetual isolation if they then travel within 2 weeks for another appointment. The unhappy situation also affects a small number of patients, and we will act to help them. We have agreed to a test on day 7 for patients with 2 or more appointments in a rolling 4-week period, and the same will apply to their escorts. Providing the test is negative, patients and escorts will be released from isolation under the same rules as when we offered day 7 testing for all returning residents. We've also looked at a new regime for key workers who reside in the Isle of Man, who come and go for work purposes, but often find their isolation periods at home are almost exclusively spent in self-isolation for the entire period. We have agreed that these workers can also assess a test on day 7 to be released from isolation after a negative test and allowed a level of freedom subject to the same restrictions as the previous day 7 test. Both changes will be available as soon as the necessary legislative changes have been made, which we expect to be in place early next week. I now turn to Brexit. I'm sure many of you will be aware that negotiations to agree a new relationship between the United Kingdom and the European Union have intensified over recent weeks. There remain, however, some significant areas of disagreement. Both sides are eager to reach a settlement to give businesses and people a stable environment in which to continue to trade. But key differences in opinion remain, in particular to fisheries and the level playing field. We remain in close contact with the United Kingdom government and our friends in the Channel Islands, both at political and officer level. We are keeping abreast of developments in the negotiations and ensuring that our interests are protected and represented within the talks. But we cannot make assumptions on the outcome of these talks. Whilst there is room for hope, there is still the very real possibility that they may yet fail. There are now 63 days until the transition period comes to an end. New rules will come into force for the United Kingdom and ourselves from the 1st of January 2021. For many people, there won't be any change. But if you visit the EU, trade with the EU, or come from the EU, then it is important to check if there is anything you need to do to prepare for these rule changes. We have identified areas where our people and our businesses may need to do things differently. We have refreshed our websites to ensure that everything is up to date and relevant. We have also updated our interactive guide, which is available at gov.im. And you will see information popping up on our social media channels. A wide range of topics are covered. They include our new EU settlement scheme, which enables EU, EEA and Swiss citizens to protect their rights to continue living in the Isle of Man. We should all check our passports, which need to be valid for at least 6 months when we travel. We wouldn't want to see any of our citizens stranded at a UK airport because they did not check their passport. There are new rules to follow when travelling to the EU, including information on travelling with pets. The website explains the new customs procedures and has information for export and import businesses. Now, this is just a flavour, as there is too much to mention here. It is all set out in the website and guide, which offer an easy-to-use overview, and there are signposts to other documents and websites for anyone who needs further detail. Now, it's not often we talk about scallops at the media briefing, but I want to mention that the measures which we have put in place for the start of the King Scallop season on Sunday. So many things about this pandemic are described as unprecedented, but the word is apt. We can see, almost literally, an issue coming over the horizon. Crews from Scotland and Northern Ireland who are licensed to fish in Manx waters use our harbours. As our borders are closed, we have to put in place security and safety measures to ensure visiting crews do not breach our border restrictions. The scallop season is important to our local fish processing sector, and we have made arrangements for the catch from visiting boats to be landed. It has been quite complex to arrange, but the basic rule is straightforward. Visiting fishermen will be allowed to tie up their vessels in Douglas and Peel, but must not disembark for any reason. Officers have had close contact with their counterparts in other jurisdictions to ensure the measures are understood. We welcome the visiting fishermen, but this year under a new regime. There will unfortunately be fencing and some security staff at the harbours, creating, I suppose, a tangible border. It may feel and look a little strange. But we have no active COVID cases in the community, and we want to keep it that way. The Isle of Man's borders are currently closed to non-residents, and that includes fishermen. And now to questions from the media, and thank you all for your patience, and I apologise for yesterday's briefing had to be postponed. First up today is Rob Pritchard from 3FM. Good afternoon, Rob. Faster Mai.
Faster Mai, Chief Minister. My first question to both of you. What are both your initial reactions to the resignation of Dr. Rachel Glover this week, and why do you think that situation has reached this point?
I'm very surprised. I think as David has been dealing with this, I'll let David answer this one on our behalf, both our behalf.
Yes, thank you, Rob. Obviously, I'm saddened that Rachel's decided to take that course of action, but it is a decision for her. But I think one of the important things to stress is our entire response. We have very highly qualified microbiologists. We have very highly qualified staff in pathology. Our entire system is not based around one individual person. And I know that some staff within the department have actually been quite upset about the way things have been reported over the last few weeks, in terms of the fact that it's been suggested that everything is reliant on one person. In fact, you've given me an ideal opportunity, because I actually received a letter yesterday from a member of DHSC staff, which, with your indulgence, Chief Minister, I will actually read. I've spoken to the person. They're happy enough for me to read the letter as long as I don't share their name. But they wrote to me, which I received last night, in the following terms: Dear Minister, I'm writing to you to make you aware of how demoralised many of us feel over the media coverage of the last few weeks. The implication that our entire testing regime is down to one individual and would not function without them is as far from the truth as can be. The media reporting and social media comments that I have seen over the last week or so have left me feeling, why do I bother? We are very lucky on Ireland to have highly trained and skilled staff who, by working as a team, have been able to put in place a testing regime that is second to none and would be the envy of many countries. But for the media to portray that this is down to one individual or push that individual's views as definitive is highly insulting to the rest of us who over this year have also worked long hours and sacrificed both personal and family life in order to keep our island safe. Dr. Glover deserves praise for the work that she has undertaken, but that work has only been possible due to the fact she has been working as part of a wider team. Those of us in the wider team have just quietly got on with our jobs. We are not looking for praise or recognition, but when you see headlines suggesting and portraying that one individual is responsible for all of the hard work undertaken by the entire team, it is a real body blow. The implication felt by many of us is that it is being implied that the rest of us are either not qualified or competent enough to do our jobs, which could not be further from the truth. I wish that both the media and those on social media would think before they publish or post and think about the demoralising effect that ill-informed comments can have on those of us who have been working above and beyond, day in and day out, for over half a year now. I will leave it there, but I can't help but say that the last week and a bit has felt like a real kick in the teeth to all of us who have worked so hard to ensure we have a system that works, and can't emphasise enough how demoralised it has left many of us feeling who are just quietly getting on with our jobs in helping to keep our island safe. So I want to put on record my thanks to the entire team, both across microbiology and pathology. Rachel has played an absolutely important part in that. We have employed her for her skills. She has, as a contractor, she has done an extreme amount of work, but it is the wider team as well. And we do have very robust systems within both pathology and microbiology and a range of highly skilled staff. And I want to put on record my sincere thanks to them today. Thank you, Chief Minister.
Thank you very much, David. And now, Rob, your second question.
Thank you. This is one that I noticed from a resident online, actually, on a different note. Given infections in the UK, if they do follow this predicted trend that they could increase into the likes of March and April next year, what, if anything, has the government considered to assist residents who can't afford to lose work, leaving the island to visit their immediate family for whatever reason they need to?
Well, these are things we're looking at this moment, Rob. It's not an easy picture. There's promises going around that a vaccine will be with us sort of February, March time. I sincerely hope that's the case and that it will be an effective vaccine. But we can't predict at this moment in time. Yes, it's hard for people wanting to go away to visit family. We're looking at helping as many people as we can. We know we've got Christmas coming over. That's something the Council of Ministers is discussing. But equally, I don't know if you've read articles recently predicting that the whole of the United Kingdom could be in lockdown for Christmas and going forward for a lengthy period. I know Spain are looking at having a form of lockdown till the end of March of next year. So some of that is out of our control. My number one concern, and that of the Council of Ministers, and I'm sure all Tynwald members, is to ensure we protect life on the Isle of Man and enable our economy to continue to thrive. But of course, we are aware of the number of people who haven't family on the island and are wanting to go and see family, but their annual leave they're going to struggle to fit that all in with a 14-day period. So it's something we're aware of. I can't give you, sadly, an answer now because there is no answer anywhere in the world on how we handle this situation. Thank you very much, Rob. Next we have Paul Moulton from Isle of Man Television. Good afternoon, Paul. Faster Mai. You want to unmute yourself? Would you like to unmute and start again?
Can you hear me?
We can indeed.
I thought it was all technology that was done for me, so my apologies. Before I give my first question, I do have to make some sort of retort to what you read out, Mr. Ashford. You're basically trying to put here that the press shouldn't do their job. Surely, the fact is our job is to question what we know about. And because Dr. Glover hasn't done any press, we are only going on her tweets, but that is our position, surely. We can't be blamed, and I'm using that word as the press, for reporting things.
I fully agree, Paul. I'm not blaming the media in any way for reporting things. What I am doing is I'm reading out a letter which I have received from a member of staff, which I received in the post yesterday, which I think is, which I think their view is just as legitimate as anyone else's. But it is important that there is balance to these things, and I think that letter brings balance to this.
And your job is to obviously retort to things that come up. That's what we're doing these press conferences.
Yeah, and in fact, we did an interview on Monday where we discussed this very issue.
Right, your question, Mr. Moulton.
A presentation to Tynwald on Tuesday, didn't she? So was her information well received? Was it acted upon? And what happened? What extra can you tell us about that?
Well, the presentation to Tynwald members was around testing. So it was around PCR, what does a PCR test do? So it was factual information. It wasn't recommendations or anything like that. It was explaining what a PCR test is, what its limitations are, and why it is classed as the gold standard test. It was an absolutely excellent presentation. It was very well received by members, and I think it has made it a lot clearer to members of Tynwald why we use PCR testing and why that is the gold standard test compared to all the tests that are on the market.
So you'll be acting upon her advice on that, will you?
Well, there was no advice. It was a technical presentation around how PCR works.
Yeah. Can I just remind you, Paul, before you start your second question, that we have Mr. Khan, who is head of our microbiology, and a number of highly qualified people in that team who advise government and advise our Gold Committee on the decisions which help the Council of Ministers form their decisions. So this, whilst we respect the information and the presentation was very good and well attended by all accounts, we have our own qualified people who are full-time employees of government advising the Council of Ministers on this one. So your next question, Paul.
Well, the reason we didn't have the press conference yesterday, it said workshops. I understand it really was a tabletop exercise by Comin, looking at all the different scenarios. And you've released some of that information there, what you said earlier. Was there more to it? Have you got a full way forward from now on, that you have a pathway that you can take?
Well, yes, we've released some of what we discussed yesterday, Paul, but obviously there was more where Council of Ministers needed further information. I don't like announcing things until we've got a clear pathway on how we're going to operate it and make sure that we can operate that. And we felt we needed another week on some of the greater detail on how we were going to implement what we're going to announce. So I would hope that next week we'll have more from yesterday's meeting. But it did go on a lot longer because we're dealing with a highly complex situation at this moment. It's fast moving and we've got to get it right or as best as we can for the people of the island. I don't know, David, do you want to add anything?
Yeah, so obviously Council of Ministers continuously reviews the policies we have in place. We tend to review policies on a 2-week rolling basis, which I think we've discussed in interviews before, Paul. This is no different. Yesterday we were looking at all the various facets. Obviously the change in the situation in the UK, where it continues to see growth, plays into that. So it was one of those review processes and times. And unfortunately,
basically for everything. Well, today obviously things can change, but you've sort of got a blueprint for various scenarios. Would that be the correct?
Well, we look at every single policy that we have in operation at that particular time, and whether it is still working and whether we need to adapt things. And that is the correct way to do it because all of the different policies interlink.
OK, thanks very much, Paul. We're now moving to Simon Richardson from Business 365. Good afternoon, Simon. Fast am I.
Good afternoon, gentlemen. If I could return to the issue of testing. Now, I think it's Dr. Glover who's on record as saying that by ditching the 7-day test option for people coming back to the island, we are effectively depriving ourselves of valuable data. Now, she suggested, I think it was 14 days isolation, but with a test on day 13 and release on day 14. Now, the rationale was, I think, that we'd at least know what the COVID-19 impact rate was and be able to do the genomics for track and trace should it spread. Now, to the layman, that sounds like a common sense approach.
OK, David, do you want to take that?
Yeah, so this is something myself and Dr. Glover agree on in terms of surveillance testing. I think we do need to move to some form of surveillance testing. But again, that needs to be decided. Is it the 14 days or otherwise? But one of the crucial things as well is one of the things I'm not in favour of doing is going down the route of mandatory testing for people. I think in terms of testing, it must be the person that decides they're happy to be tested. The problem with 14-day testing is once their 14-day isolation is up, they're not getting any benefit from having that test. So it wouldn't be a charge for test. It would be done as surveillance. But it's not a pleasant experience, the test, and it'd be interesting to see how many people really did uptake it if we offered 14-day testing. That was, of course, the other thing with 7-day and test, because there was a benefit to the individual from that, because they were paying for the test, and if they came back as negative, they were allowed for the second week basically a modulated self-isolation, a modified self-isolation, which obviously we had to remove because of the situation in the UK. But Council of Ministers will, over the next couple of weeks, be looking at what we can do around potentially surveillance testing, because one thing I do agree with Rachel on is it is useful information to have.
Okay, your next question,
thank you. Yeah, secondly, I mean, we've seen the escalation in cases in the UK. What do you perceive as the worst case scenario for the Isle of Man? Is there a point at which you would consider halting all unessential movements on and off the island again?
Well, we can never say never. I sincerely hope that's not the situation. I know how important it is for our local people to go away to visit families, but we're seeing significant lockdowns in most of Europe at this moment in time. If the situation gets worse and the whole of the UK was in total lockdown because the virus was in the thousands per 100,000, say, then that's something we would have to look at again. But it's not in our imminent plans at this moment. But I can't give you, no, we'll never do that situation. That situation will never arise, Simon. So I hope it won't. I hope we'll never be in that position again. But I can give no guarantees. But we're not discussing it at the moment in Council of Ministers, just to reassure everyone. Thank you very much, Simon. Now we move on to Alex Wotton from Manx Radio. Good afternoon, Alex. Fast am I.
Good afternoon. I too want to focus on testing, if I may. On the 15th of October, you said you'd increased your daily testing capacity from 300 to 800. As of yesterday, 53 people were waiting for tests, just 6 people awaiting results. So why haven't we seen this reflected in the testing numbers, and when are you going to step up community testing to make use of this extra capacity?
David.
So in relation to that, Alex, we were, if you go back over the figures, doing on average just under 200 tests a day when we had the 7-day and test in place. Obviously, the 7-day test has now been removed. Community surveillance wouldn't actually at the moment give us much because there is no active COVID community within the community. So what we need to do is more surveillance testing around those coming back, which ties into the answer I gave to Simon a few moments ago, whereas we look, do we do testing on day 10? Do we do testing on day 7, offer it to people? Do we do testing on even day 14? And like I say, there's going to be conversations around that over the next couple of weeks. But there is no point just doing general community testing, because that is something you would do in the middle of a pandemic in order to try and trace the roots. So that's why the numbers are low at the moment.
That said, before you come into your next question, Alex, that said, I think we've done 1,500 tests in circa in the last fortnight, because we're testing everyone who's coming into hospital for a procedure. So I don't want you to think they've just dropped off. We are doing, and anyone who feels ill and dials 111, and obviously key workers for health and social care. So we are still doing tests, but it seems a pointless exercise doing, say, 1,000 tests a day when we haven't, bearing the cost, when we haven't got it in the community. So it's just trying to get the balance right, but we're making sure that we have the procedures and the system in place that should there be a downturn in our situation, that we can flick the switch effectively and do a significant increased number of testing. So we're ready for that, but I can't see there's little point in doing 1,000 a day if it's not in the community. We're doing enough tests in the community, and I'm sure we would pick up with the tests we're doing if there was a case in the community at some stage. I don't know, David, if you wanted to further expand.
Yeah, the other thing we are doing, which we weren't doing during the pandemic due to the limited amount of capacity of testing, is where a case emerges, like the Chief Minister's just announced the case today, we are automatically sending for test any high-risk contacts. So even if they are not displaying symptoms, they are still, after they've been identified as a high-risk contact, they will automatically be sent for testing.
Well, if I can just expand on that then, if somebody is concerned that they might have it and it would be from a community transmission, which obviously you're saying there isn't a community case at the moment, but there are rumours and not everybody believes that. So if somebody does think they have symptoms, are you willing to expand the testing that they could self-refer, right, rather than waiting to come into self-isolation or anything like that?
Well, no, it wouldn't be self-referral, Alex. It'd be based upon the symptoms the person has shown. Testing is a medical process. We won't be setting up a self-referral system because, unfortunately, you would have people referring themselves time after time after time to be tested. There is some people who I've spoken to who have been absolutely convinced they've got COVID. It has turned out they haven't. It is important that there is that medical triage in terms of testing. But in terms of surveillance, like I say, we will be having conversations around that, but it needs to be done in a measured medical way, and there has to be a medical benefit to actually doing that surveillance.
Yeah, so call, if you think you're in the community and you might have COVID, the option is there for you to call 111, speak to a medic who will give you advice on whether you need a test or not. So it's not. We're not saying no. It's just ring a doctor. Don't just you don't have the right just to turn up to be tested because you think you might. Speak to the medics on the official call line.
But isn't the whole sort of default position to say isolate for 14 days so you wouldn't be tested and you wouldn't find out if you had it or not?
No, if someone is displaying symptoms, they would be referred for testing.
Okay. Thank you very much, Alex. OK, we move on to Josh Stokes from ITV Granada now. Josh.
Good afternoon, Chief Minister. I've received information suggesting that there are key workers who are working amongst Manx workers without restrictions after self-isolating for just 7 days, followed by a test. So firstly, can you confirm that there are some key workers on the island that are able to work alongside Manx workers without restrictions after 7 days in the test?
I'm led to believe in the medical side of things, in the Department of Health and Social Care, where we've got a consultant maybe coming over who has to meet with the public to deal with certain criteria. Yes, I'm not aware of anything else. David, would you like to share that?
There's several key pathways for key workers, which I think we've discussed before, Josh. One of those is 7 day and test, where people can then do further duties. They're still restricted duties, I should point out. So there is still social distancing employed, PPE employed, but they may obviously have to work with Manx workers. There's also, within the medical side, we do have people that come over for the day, at which point we use a rapid test, which we're limited to 16 a day to be able to do that. That will give the result within about half an hour to an hour, that will tell us whether that person is free of the virus, and then on a clinically based judgment that person can go about their work. So there is various key worker pathways there, but they do still have restrictions on those pathways as to what people can do and how they can interact with others.
Putting the medical key workers to one side, can you just explain the decision process being made of which key workers can work under what restrictions, and are they purely on a case-by-case basis? Yeah,
so it is on a case-by-case basis. What's taken into account is the role they're being brought over for, what that role actually consists of, who they will be coming into contact with during that role. And from that, there is a list of restrictions placed upon them, as I've mentioned there, about PPE or social distancing being employed. Some will potentially be able to access 7 day and test, again based on a risk-based approach. Others will not be able to do so and will either need to isolate, or if they're a key worker that is actually working in isolation in their work environment, so they're not going to come into contact with other people, then there's various different restrictions that may be placed on them as well, where they can go to work but they have to travel from home to work and then back to their place of isolation immediately afterwards. So this all feeds into the various key workers, but it is based upon the role the person is doing and the risk mitigation pathway behind that.
Yeah, and the plan is put into play. The plan is agreed before they come to the island. They don't just rack up and then we agree a plan. It's thought through, and then various situations fit various models.
Yeah, it basically forms part of their isolation order.
And is this modification published anywhere that people have access to at all, in any of the models that you've spoken of?
So I'm not sure. I'll have to check on that if the 3 pathways are published. But it is not. This isn't something new. This is something that has been in place throughout the entire pandemic period as well.
Yeah, but if it's not published on our website, I'll ensure it is, Josh. To make sure everyone's got nothing to hide. It's more than happy for it to be shared.
Brilliant, thank you. And my second question, Guernsey has moved into testing at the border and bringing in isolation periods for people travelling from the UK. Despite many viewing what has happened with their cases spreading as a setback, they seem to be arguably going for a more progressive approach, moving things forward. Is the government here not being ambitious enough? And how open is the government to trialling new methods such as this?
Well, we're always looking at new ideas, but if you look at Jersey, who have a test at the borders situation, at this moment in time there are schools shut in Jersey. They have 60, 70 active cases in the community, and they have social distancing, and you can't have gatherings over a certain number. We don't have any of that. So I'm not convinced that, people have been mentioning Jersey, which Guernsey have been looking at, and opening their borders more. We have an awful lot of freedoms here that very few people in the rest of the world have, and I think we're all keen to protect that. I think you also have to look at the infection rate per 100,000 in the regions that travel from into the Channel Islands compared with the Isle of Man. If you look at the Isle of Man, sadly, the northwest region is significantly high, whereas the southeast, though it's rapidly catching up with the northwest, the south in Southampton, etc., doesn't have the high levels of the infection rate that the northwest do. But as I say, sadly, the south is starting to catch up with the north, and there are predictions that the whole of the UK will be locked down. So, yeah, we look at other matters, other jurisdictions. If you look at New Zealand, for example, everyone mentions how successful they are. When you go to New Zealand, you are put into a quarantine centre before you can go back into the community. I'm sure our people coming back wouldn't want us to be doing that again. We did it in the luxury of one of our best hotels. Their quarantine centre, I'm told, is sort of a 1-2-star establishment with sort of a bed, and that's about it. So, yes, we look at other systems, but at this moment in time, we're not seeing anyone with a shining light that's doing significantly better than the model that we've got. But if there are any tweaks going forward, then I've always said plagiarism is the most sincerest form of flattery, and we'd be more than happy to adapt or copy. David, anything you want to add?
Yeah, just around border testing there, Josh. With border testing, obviously the test we use is PCR, which is the gold standard test. It's the best test available. But we do have to recognise that even that form of testing has limitations. And I think we've had discussions before about the way COVID-19 interacts in the early days of incubation and the chances of picking it up. If we were to rely solely on border testing, the figures suggest that we would only pick up 7% of infected cases through border testing. If you would have to do later testing, day 5, day 7, as we were doing, or day 10, to pick up day 10 testing. You would expect to get about 98% of cases. So you wouldn't do border testing just in isolation and say you've passed a test at the border, you're free to go out in the community, because that would be the quickest way of us ending up back with community spread, because we would only be expected to pick up 7% of infected cases from that form of testing. And the other issue, and the issue then is, well, if you're going to put people, say, in isolation for 7 days or 10 days until they do a test further on, is there really a point to border testing?
It's highly complex. As I say, we have Mr. Khan, our consultant microbiologist, as part of the group that feeds up information to the Council of Ministers when we're making these decisions. But we also have to look at a load of other data. How, for example, is our emergency department coping? How are our intensive care bed numbers looking when we're looking at all this? And what is your appetite for risk? So one area might say, well, you might be able to do testing and be a little bit more lax on the border controls. But where we're seeing now hospitals throughout the northwest closing to elective surgery, for example, because their emergency departments and their intensive care are about 95%. Given the rise of COVID and flu in the community. So there are a significant number of parts of information from different areas that we have to take on board when we make these decisions. It's not just a testing regime. What is important is that we have the infrastructure, the people qualified, the quantity of swabs, etc., so that should we have a situation that suddenly changes, we're ready for it. And I don't, David, anything extra?
Just the final point as well is, it's a balance between what would it actually give us compared to the cost. So Guernsey, you mentioned there, Josh, I believe the cost to them has been about 4 million for setting up this border testing. But what will it actually tell us that we don't already know? Because, like I say, testing will only pick up about 7% of infected cases if we do it at the borders. And if we are asking people to isolate anyway, it doesn't really provide us with any more reassurance than we have with people isolating now.
Yeah, and just finishing on that final point that David's just raised, if you get a result that tells you you're negative when you've come to the island, you may not be as compliant with the 14 days isolation. If you think, well, I've got a friend's party down the road or a christening coming up, I've had a test, it's fine, it was negative, I'll go off. Whereas we know that whilst we have the very best test, we believe in the world that we use on the Isle of Man, it does not pick up people with COVID if they're not shedding. And therefore you could have a negative test, go home, get out, spread it, not intentionally, of course, but because the test has not picked it up. So we have to remember that. I've always said I look forward to the day when a test comes out that when you're tested, it gives you yes or no, you've got COVID-19. We're not in that situation yet. We use the very best test available, but it still does not tell you definitively in the early days if you have it. And that's why I've always said that will be a game changer on how we go about everything that we do. If that sort of test is developed, and it's being worked on as we speak, but if it comes on the market, it will make a significant change to everything that we do, really. We can revisit everything, but at the moment, we can't. Thanks very much, Josh. We move on to Isle of Man newspapers, and Sam Turton. Good afternoon, Sam. Fast am I.
Fast am I, gentlemen. I just wanted to start with, in the UK at the minute, they're talking a lot about people not only have currently got COVID, but also long COVID. First of all, Chief Minister, just if there's anything that you yourself, you appear quite healthy, but whether there is anything that you've noticed that has hung with you long term. And secondly, Mr. Ashford, if you're through talks in the department, if this is something that is being seen in the community at all.
Right, Sam. Well, it's a very good question. I'm more than happy to share my experience that I personally have lost probably 95% of my taste and 95% of my smell. I've had it now for 6 months. So it's been getting gradually worse. So I hope that maybe those cells will repair and come back. But that's a long COVID impact for me personally. David, do you want to expand on the other question?
Yeah, so in relation to what's been termed long COVID, yes, we are seeing some evidence of that. Thankfully not at the critical side of things, but in the more low level, as the Chief Minister's described, around taste and smell. Some people who still remain breathless, but we know from wider studies around the world, people who have catch COVID who have been perfectly healthy, even healthy young individuals, have been seriously damaged by it. COVID-19 has this sort of preference for attacking the lungs, and we know that there's cases emerging of long-term lung scarring, which has a massive impact. Also, what's been referred to as sticky blood syndrome, where it's been thickening of the blood. Thankfully, we haven't seen, as far as I'm aware, any evidence of that on Ireland. It's been more the low-level symptoms. But again, we need to engage with people and try and help them. But it is worrying, and this is another reason why it's important we try and protect against COVID-19, because even if you are young and healthy, there's no guarantee once you've had it that you are not going to have long-term effects as a result.
Thank you. And just secondly, you indulge me slightly, I want to go back to July, when the preliminary results on COVID-19 antibody testing was published. How far have we gone since then, and are the full results of that study available anywhere?
Yeah, so the preliminary results are basically going to be the full results for now, because we know now that antibodies for COVID-19 only really stick around for about 3 months. So we were planning to do a second phase of antibody testing running up to, I think, around about now, actually, in November. But there was no point undertaking that because our pandemic period was over. obviously at the July period. And after that, because of the way that we now know COVID-19 antibodies dissipate within the body, it wouldn't have actually told us anymore. So the interim report, certainly for now, is the final report.
Thank you. Thanks very much, Sam. And last but not least, Alex Bell from BBC Isle of Man. Good afternoon, Alex. Faster my.
Hello, good afternoon. I'm intrigued by the brief reference you made there to a rapid test which has been offered to key workers. Why are we not ramping the capacity for these up?
Simply because worldwide they're rationed. Governments around the world can only access these tests based on their percentage of population. So, for instance, they're cartridge based, and our allowance is 16 cartridges a day, I believe. That is it. We cannot source anywhere else. The manufacturers have rationed it to all governments around the world. So it's not just us. All countries are in the same position. It's a rapid PCR test.
Yeah, is there not a case, David, where you can only do so many with the machines anyway?
Yeah, and the other issue with it, Alex, is you can only do one at a time. So whereas with normal PCR testing, I'm probably going to use a completely unscientific term now and say you can cluster tests together and run them. With this particular one, it's one test at a time. So basically, if you did 16 a day, that's 16 hours of test.
Okay, thank you.
Thank you.
I'm sorry to leave you with a bit of a conundrum. I've had a question in from a viewer. This person is in rented shared accommodation where residents have their own rooms, but they share facilities like a kitchen, so they share bottles of milk, for example. This person is also in a kind of public-facing profession where they deal with lots of different members of the public. And as such, this person's employer says that they cannot come to work if they're in a household with someone who's self-isolating. Now, they live with a person who has begun self-isolation. So what's your advice to others who might find themselves in this rather difficult position where they can't work if someone in their household is self-isolated?
David, if you want to take that.
Yeah, in relation to that, Alex, there is no legal bar on them going to work. Because under the rules, as long as the person is self-isolated away and shared areas are cleaned down after every use, as it currently stands, the rest of the household can go about their business. But obviously different employers have their own internal policies, and in this case, the employer, whoever it may be, has obviously clearly assessed the role the person is doing and feels that it is too much of a risk for them to go to work. So that is the choice of the employer.
Right, okay. Well, thank you.
Thanks very much, Alex, and thank you all very much for your questions. Now, the tentacles of the coronavirus pandemic are indeed reaching into all aspects of normal life, but I can confirm one thing that will stay the same. Peel Commissioner's firework display will go ahead as normal from the breakwater tonight, and the organisers have worked around the new security measures there. It seems that Peel is the place to be. Some of the roads will be closed for a parade and local events before fires are lit on the beach and the display begins. If you are going, enjoy the evening and have a happy Hopchine to everyone. We are lucky that we can celebrate these festivals with family and friends in the usual way. There is no rule of 6 and we are free to visit our neighbours. Our mantra for the pandemic is very apt for the weekend ahead. Please stay safe, be responsible, and make the right decisions for yourself and your loved ones. Have a great weekend, everyone. Thank you for your attendance and interest, and see you next week. Thank you.